Alright, the next video I'm making here is on hypertension. So first of all, talk about what the JNC8 essentially says, summed up. First of all, is that if your age is over 60 and you don't have any other diseases associated with this, then your blood pressure can be as high as 150 over 90. Okay, so over 60, 150 over 90 is okay. Now, everybody else, so people that are under 60, I guess, normal people. I don't know why I chose that wording there. Everybody else, 140 over 90 should be the norm. Okay, so if there is a person who is over 60 who has 155 over 90 or 150 over 95 or something, then you need to start thinking about therapy or medication. If there is a person who is less than 60 who has 145 over 95 or whatever, or above this number, then you start thinking about therapy. So if you come across somebody, you start with giving them a ACE inhibitor or an ARB. I accidentally put CKD there. I meant to put calcium channel blockers. That should be CCB. I'm sorry. I had a slip of the brain there. So calcium channel blocker, thiazide diuretic, ACE inhibitor, kind of a choice of practice sort of thing. Most of the doctors that I've seen will start with an ACE inhibitor. If that isn't cutting it, then they might add on a thiazide. If that doesn't cut it, they might try a calcium channel blocker, not CKD. The next thing is if somebody is African American or black, or if they are greater than 75, do not give them an ACE inhibitor unless they have chronic kidney disease. So you give everybody with chronic kidney disease an ACE inhibitor. So, and also, you no longer give beta blockers to people for hypertension. Okay? All right, so how do you diagnose someone with having hypertension anyways? So you got to make sure that you got to discern here. There's primary, also known as essential hypertension, and there's secondary hypertension as well. So you kind of rule out there what's primary, what's secondary. Primary hypertension, 2 readings, probably 2 weeks apart, probably 2 office visits, and beware of white coat hypertension. So sometimes people can go in there, see the doctor, they get nervous, they get high blood pressure. So that's something to be aware of. So you might need to do it in another setting or something, like maybe at the supermarket or something. I don't know. Okay, so the other thing here is secondary hypertension. So secondary hypertension, you kind of suspect this when you've tried all these medications, you can't bring down the blood pressure. Or if somebody has high blood pressure and they're only 35 years old, and you're thinking, it might be something else going on here, less than 35. So some things to think about hypercalcemia, hyperthyroidism, aortic coarctation, or renal vascular disease, or Cushing's disease. There's other ones too, but those are a couple good ones there. Okay, so what about these medications? Kind of getting a ballpark. There's other ones you can use too, but calcium channel blockers, if you give a med and you find the person starts getting peripheral edema, it might be caused by the calcium channel blocker. Noting here the ACE inhibitors, they can cause hyperkalemia. They can also cause angioedema and a cough. ARBs can also cause hyperkalemia. Usually you use an ARB if the person can't tolerate an ACE. Thiazide diuretics, these cause hypokalemia. That's low potassium, by the way. And you stop if they have low GFR. It can also cause someone to pee a lot, which can be kind of frustrating. Loop diuretics can also cause hypokalemia and urinary frequency, UF there. And you don't give in the case of renal, I don't remember this. Renal failure and congestive heart failure are other things that are associated with there. Spironolactone is another one. This can cause, just like ACE inhibitors and ARBs, they can cause hyperkalemia. So just think about the ones that cause you to pee a lot. Those ones you pee out your potassium. Okay, peeing out potassium, thiazides, and loops. Spironolactone. This is hyperkalemia again. It can also cause gynecomastia, and it's good for congestive heart failure. I hope that's helpful for you.